Jacksonville. Enjoyed the Florida-Georgia game. Maybe not the outcome for some of the people here, but I know it's a big party, and we were watching it on TV because, we just got young kids, and it's not always easy to mix them in with some of the craziness. But I do remember when I first became, they've always talked about, well, maybe just do home and home, right? Athens and Gainesville. And I think the schools would probably make more money. And I remember that got pitched to me one time about, it'd be great for the schools. What do you think? And I'm like, what I think is this. I am not going to be the governor that loses the world's largest outdoor cocktail party. So you want to do it when I'm gone, then you can go ahead and try. But that ain't not happening on my watch. And I know we got Georgia, Florida, kind of Tampa, Atlanta coming up because of the stadium renovations. But I think it's a really important institution to have here in Jacksonville. And so you can, it's not all these things get publicity, right? Probably Pete didn't even know. But I put the kibosh on that very quickly. We're here at Wolfson's Children's Hospital, joined by our wonderful First Lady, my wife Casey. We have Florida's Surgeon General, Dr. Joe Ladapo. ACA Secretary Siobhan Harris. We have our great senator from Jacksonville, Clay Yarborough, and our great representative, Kian Michael, is here as well. Wolfson Children's Hospital, represented by Mark Toney. We also have representatives from Nemours, Nicholas Children's Health System, and Johns Hopkins Children's Hospital. So we were here within the last few months, and we're making announcements about what Florida is doing and will continue to do on combating cancer. Since 2019, when I took office, we've invested more than $1 billion in cancer research and treatment, and we've increased funding for cancer programs by over 114%. This year alone, Florida's committed nearly $218 million to cancer research through 3 initiatives that are transforming how we prevent, detect, and treat the disease. Childhood or pediatric cancer is the leading cause of death by disease for U.S. children under the age of 14. This is a stark reality for children and for families. None of this stuff is easy. My wife can talk about having gone through breast cancer, and obviously there's a lot of different types of cancers that folks deal with, but I think to have a nice, healthy 7-8-year-old kid get stricken with cancer, it shatters the family, and it's really devastating. But when you're able to do the good work that we're doing at a lot of our children's hospitals, you're able to heal those kids. I mean, that's a monumental thing to have happen. So we want to make sure we get as much as we can in those instances, because it's really, really meaningful for so many people throughout the state of Florida. So we've put our money where our mouth is. We've made a lot of investments. We created the Cancer Connect Collaborative Research Incubator Program within the Florida Department of Health, and this is a step in the fight against cancer. The theory behind it was that you'd concentrate on specific areas of cancer research on a rotating basis every 5 years, trying to enhance research capacity throughout Florida. And so we did announce when we were here earlier that the focus for the research incubator is going to be pediatric cancer research. And we promised that. We said that we were going to do. It's typically lower in funding than the funding for adult cancer research. Cancer drug and device development continue to lag for pediatric cancer patients, and industry-sponsored cancer trials involving children are limited. So the incubator seeks to address these gaps by boosting pediatric cancer research in Florida, focusing attention and funding specifically on pediatric cancer projects that advance treatment options for children battling cancer. And this was something that we had announced. We said we were working on it. I know there was different applications, and that's all kind of come to fruition for today's announcement. So we are pleased today to be able to announce $30 million of funding through the Cancer Connect Collaborative Research Incubator for 4 pediatric cancer specialty hospitals that are here today. So So Nicholas Children's Health System of Miami, Johns Hopkins All Children's Hospital of St. Pete, Wolfson's Children's Hospital here in Jacksonville, and Nemours Children's Hospital in Orlando. All 4 of those hospitals will receive $7.5 million respectively. And I know that that's going to go a long way. They did submit applications. They had innovative proposals, and they've proposed comprehensive statewide cancer research and care initiatives that have a chance to bear fruit. And when we're doing this, so private sector drives a lot of innovation, and we, that's great, and we want to see. But the reality is, I mean, the private sector is going to pursue things that are likely to have a return on their investment. That's what you're supposed to. If you're in business, you got to make money. If there are things that the prospects may be a little bit more attenuated, a little bit more remote, there's not the same market signal to go in and do. And what happens is when you do some of these things, sometimes you end up, discovering things that no one was even thinking about when they were going in. So our view is if there's a really well thought out proposal that's seeking to do innovative things, we want to provide support for that through this incubator program. And this is really going to make a difference, I think. I know that we've got some great institutions. I think our view is Florida's a great state, the 3rd largest state. We've been the fastest growing 3 years in a row. We're ranked #1 for economy, higher education. I can go through the list. We don't want to be in a situation where a parent would feel like they have to go to a different state to be able to treat their child with cancer. We want to make sure that folks know right here, we've got the best institutions you can have. So we're involved in this fight. We want to be supportive. We have said that many years, but we've produced with the funding that we've provided. So thanks to everybody that's been involved. I mean, I know we had help in the legislature, particularly had a lot of senators that were very helpful for this and got this across the finish line. So we'll be handing out these checks momentarily, but before we do that, we're going to hear from some of our speakers today. And the first one is the leader in this effort, my wife, our First Lady.
Well, thank you. It's awesome to be back here to talk about this because it is such a big deal. And really, when Florida manages their budget so well, paying 50% of the outstanding debt since the state's inception, you have the opportunity to do things like this, to be able to invest in pediatric cancer. And the governor articulated it so well. This is not something traditionally that would get a high return on an investment. It's 6% of all of the outstanding cancers. But to do this is the right thing to do. And so to know that it's $30 million, yes, this go around, but $30 million for the next 5 years, that's a big deal. And I've had the opportunity to meet a lot of families whose children are battling cancer, and it's really difficult. Because I remember when I got my diagnosis, I was just thinking to myself that I was very thankful that it was me and my family, and it wasn't him or my children. I can't imagine what it would be like to have a child who is diagnosed with cancer. But all we can say is that today, as a result of this investment in great institutions who are doing wonderful things, that there's now more hope than ever before for a lot of parents out there who I know are suffering. But know this, you got good people who are fighting for you. And if I can stand here today and say that I can beat it, I know very well that there's a lot of people out there that can beat it too. So thank you to the legislature and the governor for what.
Good morning. Don't have much to add to the good news this morning about the funding. The governor highlighted the fact that one of the great things that government can do is fill in gaps where there's a disconnect between, say, private sector incentives and what would be beneficial to people. And this is one of those areas where pediatric cancer funding is underfunded. Certainly, if you consider the value that the families who are affected place on the type of research and advances for their kids when they do become very ill, it's definitely underfunded. And so this is really a very meaningful advance by our lawmakers, by our leadership, by the vision of our First Lady through her experience in transforming that into better health and better life for Floridians. And And so it's really wonderful. I think something else I wanted to highlight is that we have these hospitals, as the governor mentioned. You know, there are certainly a handful of hospitals for adult cancer care around the country that really have centers of gravity, if you will, for attention and where people really think of as a standard of care. And wouldn't it be wonderful if parents don't have to leave the state or even travel longer than they might otherwise have to travel for cancer care for their child? So that's really another wonderful benefit of this that's sort of intangible, but definitely very meaningful to the families that are affected. And the other thing I'll add is that as these hospitals specialize in different areas, one of the things that we've done as the shepherding organization in the Department of Health is to try and set up an environment where yes, we love competition. Competition's great. Some people have it in their blood. We got a former athlete there, college former athlete. I'm a former college athlete. There are other athletes out here, so competition is really great, but collaboration is also really great. So in the Department of Health, we've worked and we're actively working with the children's hospitals. So yes, we know they compete against each other, but we also want to see some of the benefits and synergies of collaboration. So that's another piece that we're working on. So, all right, thank you.
Good morning, everyone. I'm Siobhan Harris, Secretary of the Agency for Healthcare Administration. Thank you, Governor and First Lady, for today's announcement, again, for your ongoing commitment to advance healthcare and make additional investments in healthcare that directly affect Florida's families. Today's announcement is exciting. I'm excited to be here at Wolfson's Children's Hospital. Thank you for hosting, and excited to join the Surgeon General, elected officials, and all of the leaders from the 4 pediatric hospitals. You've heard it said before that it's a great time in our state to see this funding going towards these institutions that have dedicated themselves to advancing care around pediatric cancers. As I read some of the proposals that came through, I love the focus, as you've heard from other speakers, on the fact that the investments will help ensure children can get care here in our state, whether it's treatment or participation in clinical trials. It was also great to see Wolfson's creation of a home delivery chemotherapy program through this grant, which undoubtedly will extend their reach into communities that would otherwise not be able to benefit from the quality of care that they offer. And at the agency, we're a big believer in hospital at home, and so to be able to see that come to life for children who are battling cancer is phenomenal. This is what the Cancer Connect Collaborative Research Incubator is all about, not only advancing the science around treatment and prevention, but also overcoming the barriers to accessing care. The investments in diagnostic technology, emphasis on recruitment of highly talented clinicians trained in pediatric oncology, the expansion of clinical trial options, and investment in supportive services for families demonstrate the holistic approach taken by the 4 hospitals. Undoubtedly, the results of this collaboration will change the treatment landscape of cancer care in our state. My challenge to all of you, I want to piggyback on what the Surgeon General stated, is to place special emphasis on data sharing, knowledge transfer, and general collaboration, not only amongst yourselves, but the other cancer treatment centers around the state. So every child faced with a cancer diagnosis can reap the benefits of this initiative, regardless of their zip code or proximity to your institutions. The pediatric incubator is a bold step forward in the fight against cancer, and our agency stands ready, along with the Department of Health, to support you in this endeavor. Thank you again for the work that you do to take care of our most vulnerable. Thank you for providing hope to families, and we look forward to seeing the great results that come of this. Thank you.
Lower that just a little bit. Good morning, everyone. I'm Dr. Mark Toney, the Vice President of Medical Affairs here at Wolfson Children's, part of Baptist Health, Jacksonville's only locally headquartered nonprofit healthcare system. Along with our Wolfson Hospital Board Chair, Aaron Wolfson, we are honored to welcome you to Wolfson Children's Hospital to recognize a transformative moment for pediatric cancer care in our state. I want to begin by thanking Governor DeSantis for his leadership and commitment to advancing cancer care in our state under his direction. As you heard, funding for cancer research has more than doubled, a testament to his dedication to Florida families. I also want to thank First Lady Casey DeSantis, a true champion for Florida's specialty hospitals for children. Her visit to Wilson Children's Hospital last year helped ignite the statewide effort that we are celebrating here today. We are grateful to Florida Surgeon General Dr. Joseph Ladapo and ACA Secretary Siobhan Harris for your continued partnership. Together, we will ensure that these investments directly accelerate cancer treatment by expanding access to care, recruiting top pediatric oncology talent, strengthening infrastructure, and advancing research that delivers new hope to families. This funding supports Florida's 4 nonprofit specialty licensed children's hospitals, which together make up Florida Specialty Hospitals for Children, Johns Hopkins All Children's Hospital in St. Petersburg, Nemours Children's Hospital in Orlando, Nicholas Children's Hospital in Miami, and of course Wilson Children's Hospital here in Jacksonville. Together we share a single mission to ensure every child in Florida has access to the highest level of care close to home. Although Florida is the nation's 3rd largest state for children, we still lack a top 25 pediatric cancer program. Too many families have to travel out of state for specialized treatment, an added burden during an already difficult time. That will change. Today's investment is a critical step forward. Over the next 5 years, it will strengthen Florida's pediatric cancer network, accelerate innovation, and help build programs that rival the nation's best right here in Florida. I would also like to thank our community and business leaders who are here today that have invested heavily in this project. Together, we are building a future where every child can receive exceptional cancer care without having to leave their community. The future of pediatric care starts now, and it starts here in Florida. Thank you, Governor DeSantis, First Lady DeSantis, Dr. Ladapo, Secretary Harris, and all of our partners for helping making this future possible.
All right, I think we got some checks now, so we'll go with Wilson to start. You guys want to come up?